Bye. Okay, welcome everyone. My name is Krista Martel, and I'm excited to welcome you to our second webinar from our Watch series. Today we will be presenting U equals U in 2019, how far we've come and where we're going. We're really excited about this webinar. As some of you may know, and we'll talk a little bit about this, it was 2 years ago, almost to the date, we presented our first webinar on U equals U, and so we thought it was about time to kind of, you know, get the messages out again to everyone, but also talk about the progress that the campaign has made in the past, 2 to 3 years, as well as, some of the impact it's been having. And so, welcome. I see people are still joining, and I'll just wait a couple minutes before we get started. Okay. I am going to move on. Okay. Again, welcome to everyone who's joined the webinar so far. There is a, I'm sorry, I see someone raise their hand. I'm going to ask some of my colleagues to help me if there's anything that I need to know in terms of sound or people having difficult viewing. But our agenda today is just to give you a brief introduction, also a brief definition of U equals U, and the evolution of the campaign. We'll also be presenting a little bit about our 2018 survey results, where we asked some questions on U equals U. We'll talk about some of the growth of the campaign and the milestones. We have a provider who's going to provide their perspective on speaking with patients around U equals U, as well as kind of the perspective amongst other providers. And then we have a fabulous panel who is going to be discussing kind of both their perspective of the campaign and how it's changed over the past couple of years for them personally, as well as in the community. So I will get going here. So just a little bit for anyone who's new to the WELL Project, we are a nonprofit organization whose mission is to change the course of the HIV/AIDS pandemic through a unique and comprehensive focus for women and girls. And we do that by leveraging technology to improve the health outcomes and increase quality of life for women and girls living with HIV. Our key areas of focus through our website are providing information and education. We have more than 115 fact sheets on different areas of women and HIV and women's health. We have a community support network that evolved through our blog, A Girl Like Me, and Una Chica Como Yo, and has grown to be a global community. And then we also do advocacy development and capacity building, partly through our webinar series, as well as conferences and various venues. So if you haven't been, please go to our website at thewellproject.org. Okay, this slide got a little messed up, but I'm going to hand it over to our partner, the Prevention Access Campaign, to give you a little brief overview of who they are. Bruce is muted. Wait, Bruce, hold on. You're muted. Let me see if I can. Oh.
Okay, hey.
Okay. Oh, shoot.
I'm trying.
Okay.
Can you hear me now?
Yes.
Okay, great. I will share my screen. Thank you so much for not just for having me on this webinar, but for really being one of the world leaders in getting this message out. I mean, there are a few organizations worldwide and certainly in the United States that have made this much of a commitment to U equals U in so many different ways. And you're certainly our go-to organization for all things related to U equals U and women. So it's really appreciate you and happy to be here. Okay, I'm going to share my screen.
Well, this is just, Bruce, just a quick one slide before we get into your full presentation. Introductory slide of, no, that's okay.
So U equals U is a community of people living with HIV and educators, researchers around the world. Verify that it's true, and then disseminate the fact that people living with HIV who are on treatment and have an undetectable viral load cannot sexually transmit HIV. We started this in 2016 by issuing a consensus statement to confirm U equals U, and then we started getting endorsements to that statement and build on the legitimacy of that message. And that statement really was the very beginning of this what is now just a massive global movement, really driven by the community and the researchers and public health officials who care about us.
Great, thank you. And so, yeah, and then we'll hear a lot more from Bruce in just a few minutes. So, and then just a little bit about the WATCH series. WATCH is the Women's Advocacy and Treatment Coalition on HIV, and it's an ongoing HIV treatment advocacy and capacity building webinar series. Started in 2016, I believe. And so this series is the second, as I mentioned, in our series for 2019. And we hope to do another one or two later this year. All the webinars are recorded and will be available through our YouTube channel and also posted on our website. We'll also send out a notice to everyone who is both on this webinar participating or who signed up and wasn't able to make it, with the links to all of that. If you're interested in receiving a certificate for participating in the webinar, you can contact us as well. And just a few housekeeping notes. The webinar is approximately 90 minutes, and we're going to save the Q&A for the end. But you can use the live chat box to communicate with participants and panelists. You can also enter questions for the panelists or speakers in the Q&A or in the chat, and we'll try and keep track of those. And we will have all participants' lines muted, but you can use the raise hand feature if you'd like to be unmuted during the Q&A to ask a question. Okay, so I am going to ask each of the speakers to give a brief introduction of themselves. I'll quickly go. My name, for those who are not familiar, is Krista Martel. I'm the Executive Director of the Well Project, and I'm excited to be here. So Bruce, I'll hand it over to you again.
Sure. I'm Bruce Richman, a Founding Executive Director of Prevention Access Campaign, also thrilled and honored to be here.
Hi, my name is Lisa Scotti. I'm a nurse practitioner at the Baltimore City Health Department. And I'm also a member of the Association of Nurses in AIDS Care, and I've been taking care of folks living with HIV since 1995.
No, thank you. And Davina? Sorry.
Hello, I'm Davina, advocate, activist, one of the founding steering committee members of U equals U that started 2 years ago.
Thank you. Maria?
Hello, everyone. My name is Maria Mejia. I'm the global ambassador, very proud global ambassador for the Well Project. Also their blogger, member, international human rights activist and advocate, and also a 31 survivor of HIV. Oh, and by the way, I also started with Bruce in the beginning of the fight. And I'm very, very honored, Bruce, that you thought about me since the beginning for the National and International Committee for U Equals U.
Thank you, Maria. Maria, your speaker is a little hard to hear, so I'm not sure if there's a different way for some reason. Is anyone else having a little hard time? Yeah, maybe call in, yeah. Maria, is that okay? Okay, thank you. And Katie?
Hi, I'm Katie Willingham. I blogger with the Well Project, ambassador, U Equals U ambassador, and Alabama State Lead for the Positive Women's Network, USA.
Great. Thank you, everyone. I'm having a little time. I'm not able to see the chat at the moment, so if anyone is trying to say hi to me or do anything, say anything to me, hopefully I'll be able to access it shortly. Okay, so just 1 second, please. I'm gonna just do something. Okay, so hopefully most of you are familiar with U Equals U, but just to reiterate, what U Equals U means is that when a person is living with HIV and taking their HIV medications regularly and their viral load has been undetectable, they're sustained undetectable for 6 months, that person cannot transmit HIV to a partner. And as one of the leading medical journals wrote, it's a simple but hugely important campaign based on a solid foundation of scientific evidence. So we'll get a little bit more into that and talk about some of the evidence and the updates that have occurred over the past couple of years. But that is the bottom line of U Equals U. So just a little background on U Equals U and the Well Project. In early 2017, so as Bruce has mentioned, the U Equals U campaign originated in 2016. In early 2017, the Well Project endorsed the consensus statement put out by Prevention Access Campaign, and then created a partnership with PAC, Prevention Access Campaign, and then we worked, diligently to try to put together a fact sheet about U Equals U, both in English and Spanish, with, as the Well Project does, always trying to also have a very specific lens or put a lens on women under the U Equals U umbrella. So. And we, just so everyone knows, when we put together a fact sheet, we also, it's kind of like a library that we keep updated. So most of our fact sheets are reviewed with an editorial team that includes doctors and nurses and our editors that go through an annual process to make sure that everything is accurate, that we're including the most recent data. So while they were launched in 2017, they've been updated since then and will continue to be. And then shortly after the fact sheets were launched, we hosted our first webinar. And that was really just to help get this information out to a wider audience. As you can see, the title of our fact sheet, this is a graphic that's on our fact sheet that we created, but the title of our fact sheet and kind of our main thing is that it's building hope and ending HIV stigma. One of the things that the Well Project has been really passionate about throughout, since it was initiated, is that HIV stigma is one of the, biggest obstacles to ending the epidemic. And we believe that the impact of the messages around U Equals U has on personal, self-stigma and being able to rid oneself of that stigma of not feeling infectious is one of the key aspects of us trying to really, put an end to this epidemic. So that message of hope and building hope and ending stigma is really important in this messaging and what we're trying to help get out to more people. So then after that, we we hosted in 2018 one of our programs is a women's research initiative on HIV/AIDS, where we bring together a group of experts from all sorts of different backgrounds, including academia, research, activists, government, medical community, and clinicians to talk about various topics and really try and focus on advancing the research and conversation and policy around different topics. And so in 2018, we held a 3-day thought leader think tank that really focused on U=U and how that applies to women, and how do we advance the conversation further on some of the areas for women. So, and the graphic here in the slide is from our issue brief that we put out, which can be found on our website. And then we've been continuing to present on U=U issues, and both on this building hope and concept to really just help more people and more women especially get this message. And then, also to start kind of furthering some of the conversation in other areas that U=U. It's brought a lot of questions up around breastfeeding, and the research that we have right now is that U=U is not just easily applied to breastfeeding, but that does not mean that we don't need more research to really dig into the data, and also to look at the policies around breastfeeding and women and HIV. So that's been something we've also been working on. Okay, so we are going to ask a few poll questions, and this is anonymous, and we just want to make sure that you can answer. These questions were questions that we also asked on our survey, and for the purpose of the survey, it was really directed towards women living with HIV or people living with HIV. So a couple of the questions may not apply if you're not a person living with HIV, and so it's up to you if you feel comfortable answering them or not. But anyways, here we go. So sorry, 1 second. I'm having mouse problems, and I'm trying to figure out. Okay, it's not working. All right, I'm sorry, everyone. Well, I will get back to the poll. I'm just going to continue at this point, and I'm sorry to not be able to do this. Unless, actually, can one of my colleagues launch the poll? Jenna or Olivia? Is that?
It's Jenna. If you tell me how to do it, I can try.
Yeah. Is there a poll? Do you have the polling thing in your menu bar?
Nope.
Okay. All right.
Yeah, unfortunately, I don't see it in mine either. This is Olivia.
Sorry, everyone. I don't. I never quite have a clean break with technology. So, okay. Well, I'm just going to go ahead with our survey data, and we'll see if we can get back to it. So essentially, our survey that we do every couple of years is a way to measure the impact the WELL Project's programs are having on people's lives, particularly with the focus on women living with HIV. But then we also ask questions on different topics to get more information, to help us better assess the programs that we can provide. So this past survey, which the report is not yet out, but will be out in the next few months. This is preliminary data that we are sharing. We asked some questions around U=U. The final results include information from 239 respondents. So this was all women living with HIV responding to these questions. 85 of the respondents were either very or extremely familiar with the U=U message, and 78% were very or extremely confident about the U=U message, meaning that, when asked if, they feel confident about the data that, you know, U equals U represents. They felt very confident about it. And then 72% said that learning about U equals U has had a tremendous or significant positive impact in their lives, which again goes back to the building hope and ending HIV stigma. However, 64% reported that their healthcare provider had never discussed U equals U with them. So we felt that that is really an important part, and why we also wanted to have a provider who does share the messaging with their community be on this call. But I think that's an area that we hear from many that it's still not being spoken enough. So that is our just our brief introduction, and now I'm going to hand it over to Bruce to talk more about the campaign and how far it's come in the past several years.
Fantastic, thank you. Okay, I'm going to share my screen now, and just let me know if you can see it okay.
Yes.
Is it okay? Okay. Excellent. Okay, well, so when we did our last webinar 2 years ago, the number of organizations that had signed on to the campaign, signed on to the consensus statement, which was really important at the time to get those numbers up, because this was the way that we were proving that U equals U was true, was 280 in 34 countries. And we were so excited. We were like, U equals U is around the world. This is amazing. And now we're at a place where we have 880 partners from 98 countries. That's almost half the countries in the world, on every continent except Antarctica. And these are partners that have come to the website and signed on and made commitments, and many of them are working with us to get this message out through their cultures to reach every key affected population. The way the message gets out is through the partners. We don't develop campaigns for everyone affected by HIV. The organizations we partner with develop those campaigns. So why is this so important? I'm going to first just talk a little bit about why this is important and how did we get to U equals U, and then I'm going to go into like what's happened, what kind of amazing things have happened since the last 2 years since our last webinar. But I think it's important to talk about why, and always remember the 4 key reasons why it's important. First, so many of us living with HIV never imagined a time when we could love, we could have sex, we could conceive children without fear. Fear had been present in the most intimate moments of our lives, and U equals U sets us free. It transforms our social lives, our sexual lives, our reproductive lives. It dismantles the stigma that we have been living with, the internal, external stigma that we've been living and dying with for decades. And it can encourage more people to get tested, because HIV is seen as less scary, and also improve each stage of the treatment cascade. We're seeing people go on treatment and stay engaged in care and stay on treatment for their own health as well as for their partners. And finally, this is really important, and this is something that we're not getting in the United States. We have so many sad and shameful examples of how we're not getting this, but listen to this. Our advocacy in the United States for treatment and services and care was, we need treatment to save our lives and for the health and well-being of people living with HIV, and because healthcare is a human right. We believe that, I believe that in every cell of my body, but what I've learned very quickly in the field is that many legislatures, influencers, policymakers don't care about our well-being. And they don't believe that healthcare is a human right, but what they care about is ending the epidemic and prevention. So now we have that argument about that we need these services and treatment and increased funding for our well-being and to prevent new transmissions, which will get us closer to ending the epidemic, and will address what Marcia Martin came up with, called the third U, universal access or the unequal access to treatment. We must use U equals U as a public health argument in our advocacy work on the Hill or on any of our state legislatures. So why did we need the U equals U campaign? Well, this slide could be an entire conference in itself. This is a big deal. So why wasn't this shouted from the rooftops? Why did some people know U equals U and other people didn't know U equals U? Why did people withhold the information from us? Well, there are 2 main reasons. that I'll talk about today. One is the U equals U science was based on a whole body of evidence. And typically these research studies are promoted independently by the institutions that fund them. So, when HB 10052 came out in 2011, it was presented at CROI in 2000. It was that, NIH presented it very, very well individually. But this message was the whole body of evidence and all the observational evidence of no transmission occurring since the beginning of era T. So science doesn't have a publicist. This aggregate of science had nobody taking care of it. And so how could people draw conclusions based on all these different studies? Some people found out, like me in 2012, from my doctor who was very well connected to the medical establishment, but other people, weren't learning. And I think that leads to the number 2 issue, is that, this is we're up against and continue to be up against a field that is steeped in paternalism and prejudice, that has given HIV information providers permission to decide for people living with HIV rather than to empower us to make those decisions for ourselves, especially communities that have already been marginalized by the healthcare system. So we had enough. We believe that this is a human rights issue. All people living with HIV need this information, and our motto was tell the truth or we will tell it for you. And we are telling the truth all around the world. And I'll show you a little bit of that. So what did we do? I think folks know we went to the lead researchers. We said, your science isn't getting out to the people that is intended to benefit. So they did something extraordinary. They worked with us on our consensus statement to confirm that U equals U was true. We developed an advocacy video at that time as well. In 2016, Broadway Care supported us, took the lead to support us individually. So we had the science document and we had the advocacy video as tools to go out there and show the emotional and scientific relevance of U equals U. New York City signed on right away, which really ignited the campaign. Terrence Higgins Trust was working in New York City, in London on their campaign. They're really a world leader on this, and NASTAD joined right after that. This was also the time when we started talking to Health and Human Services to update their risk assessment. We needed to move forward and update across all health departments. And then something really extraordinary happened. That consensus statement started getting spread around the world. From all parts of the globe, people were rising up, people living with HIV and who care about us. Most of these were people living with HIV movements. And it's really, really, truly exciting. So one of the things I love the most is how these alliances are happening across world, across class, across gender, across sexual orientation, immigration status, working together, finding organizations in your countries or your regions to ally with in order to fight the establishment to get this message out. Here's just one example of the sharing that goes on of materials. These are women living with HIV and the island of Mauritius off the coast of Africa who downloaded the materials from the International AIDS Society in Switzerland and Saving Lives in the UK for their march in Mauritius. Lots and lots of activity around the world. And now I'm going to come to what are some of the milestones since our last webinar. Well, right around the time of our webinar, this was huge when the mayor of Washington, D.C. signed on to the campaign, U equals U campaign, and launched a citywide on buses and billboards. Now, keep in mind, this is when people were fighting us in the United States. We had people saying you'll get sued if you fund U equals U. The head of a foundation was spreading that rumor, but Washington, D.C. had the boldness and the courage to put this on billboards already at that very same time. Right around that time, we had a press conference in Paris where UNAIDS came out and agreed with U equals U after some lengthy conversations and negotiations with them. And then something amazing happened at USCA. Dr. Fauci took the stage after we did our demonstration, with many people were involved, and said the science validates U equals U. Shortly after that, the CDC released their Dear Colleague letter, which was really the culmination in our year-long conversations with them and HHS of effectively no risk, which means actually and in effect no risk of transmission from a reduced risk to no risk. We're really proud of our relationship with the CDC. CDC Global just put out a brochure in the Global South. We're so excited to see this, the U=U brochure, to help with advocating for viral load testing and more sensitive access to viral load testing, as well as more sensitive viral load tests. And what is amazing is that they acknowledge the community and the organization that was behind U=U. They didn't need to do that. They could have just put out this. And this is a lot of respect and acknowledgement that our community is getting from the highest levels in the field, and it feels really good for all of us. So nationally, there's incredible work. This is just a couple of different examples from different continents. Canada is really where the campaign grew up. It was launched in New York City, but Canada has really taken the lead in many ways. Their whole country signed on to the campaign. Brazil endorsed their I=I campaign recently. Monaco launched their I=I campaign and signed on to PAC's campaign. And down at the bottom is the president of Zambia signing on to Zambia's U=U campaign, which is funded by PEPFAR, along with U=U activists in Zambia. China CDC endorsed their U=U, and Australasia updated their guidelines. All the global agencies now are getting behind it. UNAIDS has a U=U brochure, and as I was saying, PEPFAR and USAID are funding programs in the Global South, U=U programs. This was a tremendous moment. I think a lot of people know in August when Dr. Allison Rogers said that it's very clear the risk is zero. That was a milestone for us because we really needed to make sure that people say zero risk. A lot of people were stuck on the science and statistics. We can say zero risk now. And what's also really beautiful of her was that she acknowledged, again, in front of thousands of people, the U=U campaign and the community that helped get her research out to the public. This is U=U has been in many of the world's leading #1, #2, #3 medical journals. Now I'm just going to quickly go through what's happening around the world. Some examples of what's happened since the last time. So we created a campaign to educate about U=U and encourage engagement in care, and it features two of our amazing panelists, Dee Connor, which is the one on the left, and on the right is Katie Willingham. You can download that campaign, videos, GIFs, and posters, customized in 5 languages, and add your logos, and it's a really cool campaign. You can find that online. The UK has been a world leader, really, because if you look at those organizations on the bottom, these are national organizations in the UK, where they only have 100,000 people living with HIV, but they are kicking the butts of us in the United States. It's nonstop in the UK because these national organizations care and they're passionate and they're working together to get this information out nonstop for the last 3 years. Also in Vietnam, there's an amazing K=K program funded by PEPFAR. I'm going to be visiting there next month. This is also national strategic. The Vietnamese Positive People's Group has been leading this campaign, as well as the CDC in Hanoi. So you're seeing, again, positive people's groups around the world, not so much in the US. Also, this is one of probably our greatest activists from Uganda, William Matogo. Incredible work. I love seeing young people involved. This is a student group in Ireland, really incredible group of young people. Dublin has been awesome. ACT UP Dublin's done incredible work. This is and this is U=U on the streets of Vienna last month. U=U was the message of the light ball, where I got to speak. It was very exciting. Tens of thousands of people are outside, and the message that they're sending out is U=U in Vienna. It was amazing. So I'm just going to go through what we've learned over the last few years about language across the board, across the world. We're describing the risk between one human being and another in the most intimate moments of our lives. So we can use language that brings us together, allows us to have the freedom and intimacy, or we can use language that destroys and tears us apart. We have to be impeccable with our words. We can say the words on the left now. We can be clear. We can say zero risk. We really, really can. And if you say words on the right, you're opening up a window of risk, which puts our lives at risk. And we've got to remember viral load does not equal value. Some folks in Seattle, Washington came up with V=V. we're really happy about this, that we know that, when you're talking about this, be conscious in your communications and morally neutral about viral load. No one living with HIV is a danger. All of us can have happy, healthy, and hot, safe sex. If you have a detectable viral load, there's condoms and PrEP in certain parts of the world. And we also need to make sure that we recognize those structural barriers that make it difficult for people to get to undetectable, and use U equals U as a public health argument to remove those barriers to access. The basics of U equals U, which we just came up with last year, are treatment, labs, and connections. Stay on your on your medication, get your labs done, and stay connected to care, and enjoy your life. The nuances are not that complicated. If someone says there are too many nuances, they're just uncomfortable with the message. It's under 200 copies, which is synonymous with viral suppression. Undetectable is a moving target in some parts of the world, but the number to know is 200. This is about sex, not about breastfeeding or needle sharing. Well Project can talk to you all about women and U equals U. This only prevents HIV, not other STIs. That should be obvious. CRIM is a very complex issue, and I would go to the CRIM organizations to understand more about that. But we need to know that that being undetectable is not an exemption to these disclosure laws and these heinous laws in many parts of the world, which are terrible for all of us living with HIV and bad for public health. So I'd like to end before my quick call of action on Dina Bonds, who is the chair of Transgender Europe and the director of International Committee for the Rights of Sex Workers in Europe. This was the opening plenary at the World AIDS Conference in 2018.
Lastly, we need the undetectable is untransmittable or U is U message to become standard knowledge worldwide. It needs to sound louder every day, as this eases the burden of stigma and self-stigma of people living with HIV. It will save lives. It will reduce suicides and murders on trans sex workers.
So in closing, we hope you'll join this campaign. It's changing what it means to live with HIV around the world. Train your staff, please. Please promote at every opportunity. The New York AIDS Walk did nothing about U equals U essentially. We need to use every big opportunity and small opportunity to get this message out. Thousands, hundreds of thousands of people in the United States think they're still infectious. It's a horrible feeling, and their lives are at risk because they and others believe that. It's not true. It's urgent. Promote at every opportunity. We're tired of seeing wasted opportunities. Prioritize it. Don't hide it in page 6. Put it out front and talk about how groundbreaking it is. And stay connected to the movement. If you're not on social media, now is a great time to join social media. And lastly, we must, especially in the United States, we must hold accountable those leaders who are doing nothing. And you can tell who they are. You do not see them doing anything on social media, at our conferences, anywhere. We need everyone to join us. We need their help. We need all these organizations to come on board, especially in the US. We're far behind. And I hope that this webinar, I know it will engage more people in this continuing struggle for truth. Thank you.
Thank you so much, Bruce. And it is a big part of what we're trying to do is help get the message out and keep thinking of ways that we can collaborate, here in the U.S. and abroad to help do this. And so, I mean, one thing I've been kind of seeing the chat, our fact sheets are there to share. We want people to share them. We have slides. You can download the slides both in English and Spanish on our website. They're in the PDF format, but if anyone ever wants the PowerPoint version of them, we're happy to send that. And we're thinking of novel ways and within, the group here to help train more people to be speaking on this. So we will be definitely working on that as strategy. And we would like to have that conversation too with our panel and in the discussion part to see other ideas. So thank you, Bruce. We appreciate everything you've done. It's amazing, and just to keep the fire going and putting people, trying to hold them accountable. So just quickly, I'm going to do the poll now since I was able to make it work before we hand it over to Lisa. So 1 second, here I go. Okay, so how familiar are you with U equals U? Are you able to vote? Okay, I'm starting to see. Okay, so you see all the questions. We'll give it a few minutes since there's 4 questions. Just a minute, scrolling. Okay. So definitely more than half are either very familiar or extremely familiar. Well, more than half are extremely familiar. So we have a good percentage that is extremely to very familiar. Bruce, I don't know if you're talking to us or if you're, okay. No, okay. Me and the scroll bar. So the confidence is 73% extremely confident with another 23. So that's like almost, you know, over 90% are extremely to very confident, which I think is even way above what we had. Okay, I'm slowly, to what degree has learning about U equals U had a positive impact? So for almost 75%, it's had a tremendously to significantly positive impact on your life, and wow, almost 80% that their healthcare provider has not discussed U equals U. So that is striking when you look at the positive impact versus, you know, a provider not sharing this with you. So that's definitely one of the obstacles we need to overcome, and we'll be talking about. So with that, I'm going to share the results. I didn't realize I wasn't sharing them. So everyone can see them. And we'll give it about 10 more seconds for you to look at the results, and then I'm going to hand it over to Lisa. Okay. All right, so let's do the mouse handover.
Okay.
And I figure out how to do that. Can you request the mouse from me?
I am, all I'm seeing is a big picture of you. I'm trying to figure out how I can get the slides back.
Yeah, right. Yes, let me get back to our, goodness gracious.
We apologize. I'm not a techno
no, that's
any measure.
No worries.
We're okay.
Also, I want to apologize to everyone. I am at the Baltimore City Health Department, and we don't have advanced computers wherein I can put myself on video. So I'm just going to be a talking voice.
Okay. All right. Can we see the, are you able to see now?
No, I just see you. I'm sorry. I'm trying to figure this out. Large. Okay. There they are.
Yeah. Okay.
Remote control request.
Okay. All right. I think we should have that now.
Okay.
Yeah.
Let's go back. Okay. I got it. Well, thank you everyone for having me. I appreciate you allowing me to join in on your webinar. As I mentioned earlier, I've been a clinician working with folks living with HIV since 1995. Some of the things that, some of the slides I have are actually the same ones that Bruce has, so thanks, Bruce. And I think really I just want to more than do this thing that providers frequently do, which is spew stuff at you, is just kind of give you some anecdotal information about things that I've experienced as a clinician over the years. How'd that happen? Okay. Where did that go? I have my first slide there, but I don't see where the rest of my slides went. Hold on. Oh, do I have to go through all this again? I guess so.
No, yeah, I'm not sure how that. I feel like we're going the wrong.
No, well, oops.
I think we might be going backwards.
Yeah. Okay.
All
Now
right,
we're going.
on. Well, like I said, not very tech savvy.
Here we go. There you go.
Okay, here we go. Thank you. All right. So again, this is exactly the slide that Bruce had presented. Why does U equal U matter? Again, stigma. I've been saying this for years as a clinician. Unfortunately, stigma from the very beginning has essentially has killed, because people are afraid, as many folks know, are afraid to get tested, because then if they know, then that means that they have to, let other folks know. We're often talking about, especially here in Baltimore and many places in the world, that some of the folks most affected by this virus are more marginalized populations, and so stigma already is a large issue in their lives. And so to add on HIV infection before we had U equals U was devastating and deadly, because people wouldn't get tested. So we're hoping that getting this message out will have more folks get tested, and then more folks get access to care. And again, also the public health argument for universal access, as Bruce mentioned, because often governments don't put their money where their mouth is until there's a public health, even our, won't say his name, our president even said that we want, eliminating new infections. So if we can ride that train into getting more funding for treatment because of the science behind U equals U, then more power to us all. We already talked a little bit about this as well, but just knowing that, U equals U, we know that undetected means untransmittable. So condoms are not medically necessary to prevent HIV. Now, do I go around telling my patients not to use condoms? Of course not. I do not. I work in the Baltimore City Health Department STD clinic, and STDs in Baltimore City are on the rise. Syphilis and gonorrhea specifically, we're about to face, well, not about to, but in coming years, are going to face resistant gonorrhea as a real issue. So obviously we are still focused on the condom message. However, in terms of HIV infection, it is not medically necessary. Again, also with PrEP, we of course encourage people to take their own healthcare into their own hands. So if somebody is HIV negative and they are having multiple sex partners, they should be on PrEP. Do I tell my clients, if you are in a monogamous relationship with your partner who's HIV negative and your viral load is undetected, or you cannot spread the virus to your partner? And I will tell their partner that as well. Again, I think everybody gets to make the choice of how they want to approach their own healthcare, but I do put that message out to my clients' partners. So again, just in my experience, U equals U is a game changer if folks talk about it. In Baltimore, up to 50% of young African-American men who have sex with men, who happen to be a vast majority of my clients, have a lifetime chance of contracting HIV, 50%. I tell, when I meet with one of my young clients who is an MSM, and I tell them, I said, have you talked to, or I ask them, have you spoken to any of your friends or family or anyone about your infection and that you're on meds and all of these things? They say, no, I'm afraid to. So stigma is still a very huge part, as many of you know, of of HIV and HIV care. And I very specifically, on the first visit, before I even prescribe, when I prescribe, I should say, I tell them, I said, when your viral load becomes undetected and you are undetected for 6 months, you cannot pass virus on sexually. And they look at me, you can see, you know, in many of them, their eyes light up, and that makes them feel so much more confident, yet they still are afraid to tell their friends. And I tell them, I said, if I had 100 of you and your friends in a room right now, you know, assuming, you know, young MSM, African-American MSM, if I had 100 of your colleagues in the room together, 50 of you will contract HIV if we don't get this message out. Between PrEP and U equals U, 50 of them. So, and as I said, if you look at my slide, up to, you know, that number is even higher in the trans community. So, you know, this message is critical to get out to folks. Most of my patients have no idea what U equals U is when they first come to see me on their first visit. And again, I do have clients who have been undetected for years who still are fearful of disclosing to their partner. Uh-oh. Uh-oh. Okay, sorry. We've known that the science has been there. I mean, the science has been there for U equals U for a number of many years. I mean, we've known for years that an undetected viral load in pregnant women, along with other practices, obviously, you know, cesarean birth and at that time, and not breastfeeding, virtually eliminated vertical transmission in the U.S. There's very little vertical transmission in this country, in the U.S., if a woman is in care when she delivers and before. So we've known this message for a long time. We've been very equivocal in adopting it in practice because we've been equivocal because, you know, clinicians, and this comes up later in a slide, are very data-driven, oftentimes, especially in large medical institutions. And so until, you know, it's out there on paper that says, yes, this is the policy, this is the guideline, then folks are not as apt to adopt it. So this is my buddy and peer, Sebastian Ruse, who's a doctor here in Baltimore. You know, Baltimore is, as I said, a very high prevalence area and is really working on adopting this message. But again, we are, as Bruce had mentioned, we're not as far advanced as we could be. We also, like he said, in DC, they've slapped it on the side of buses. We have it here at bus stations and on buses too, but it's not as prevalent as it should be. In my world, I work with mostly infectious disease clinicians. So many of my colleagues have been in this fight for a very long time. And the U equals U message has been, just like when protease inhibitors came out in 1995 and we all jumped for joy that we had something that we could give to folks that would prolong life. When U equals U finally was adopted, we were jumping for joy because now we can actually use the words that we've all been wanting to say. Problem is that even in Baltimore, where, like I said, the prevalence of HIV is very high, primary care providers, so folks on the ground seeing, you know, all of us, you know, just going for our regular health care, aren't as in the know. They're not even in the know about Hep C or HIV in general, like testing guidelines. They're not always, and that's for a variety of reasons. One is that as a primary care provider, you have to deal with every single issue somebody has in a matter of 15 minutes, which is untenable. However, it happens. But people need to be educated. Clinicians need to know that everyone should be tested for HIV, and that if your client is positive, that getting them on treatment will eliminate their chance of transmitting virus. and we need to be educating our colleagues, and that's on us. It's also, I mean, the advocates like you all, many of you out there, and Bruce and the Well Project are incredible at advocating, but it's advocacy doesn't always reach the people that need to hear it, and there's definitely a barrier there, and I'm not exactly sure how to fix that, other than that we all should go to conferences and rallies together. This is one of the Baltimore City Health Department campaigns, are you in the conversation? So it is a community-driven movement. Baltimore, like many cities, was very slow in the community, in some sectors of the community, to even acknowledge HIV as an issue in the community. And so there's been layers and layers and layers of having to break down stigma to get to where we are now, and then even more to get beyond where we are now. So what is my role? Messaging, education, adherence, and advocacy. I would say that's all our roles. For providers, understanding how this message affects people living with HIV. Obviously, as Bruce mentioned, consistency with language. It's not anymore virtually, effectively lowering the risk. No, you cannot spread virus. You won't, there is no risk, not low risk, not just in case, but don't worry. Just take your medicine. Stay focused on you and your health and taking your meds and staying in care. So that's critical. Education points for everyone. This is one of the things that's sort of been a barrier in terms of and not only U=U, but also PrEP, is that Baltimore is very focused on its STD rates, which are, as I mentioned, high. Is it possible that people will use condoms less because they know that they can't, that HIV won't be transmitted? Maybe, but that's not the point with U=U. That's a separate message. We need to be doing better at educating people about each issue. Encourage dialogue in every setting. I'm going to use be a little personal here. I hope nobody gets offended, but I recently noticed that on OkCupid, a dating app, that they ask, one of the questions that they ask is, would you date someone who has HIV? And I answered yes, and I put it down. You can write little comments. I said, U=U, and I explained it, because it's critical that we all personally, not just as clinicians, get out there and make sure that people understand. And then also what I do, as I said earlier, is that, somebody who is negative and who is in a monogamous relationship with someone with an undetected virus is considered low risk. So, PrEP, that's up to them, what they want to do. But I talk to my clients about that as well. And then again, I just said it, when do I talk about U=U and when should we all? All the time, whenever we have the opportunity. You meet somebody who is a primary care provider. You meet somebody who's a dentist. You meet somebody, you go to the pharmacy, and we should be talking about it. Like, hey, HIV, it's a big issue here in Baltimore. We're doing our best to prevent new transmission. Here's one of the ways. I try to bring it, it's not the first thing I lead with all the time. I usually say hi first, maybe, but I talk about it a lot. And I think that more of us need to do it. And I think that advocates, all of us, can be out there and saying, hey, to whomever, everywhere. Am I done? Pretty much. And then for folks who are living with HIV, demand access to care and treatment. The thing that's wonderful about Maryland is that we do have a lot of resources for people living with HIV. If you don't have, if there's no one in this state, no one should be without treatment options, because we have a lot of programs. So getting people tested and into care is essential, because care is available. I know that's not the same in many other countries. I know it's not the same in even many other states. But here in Maryland, we have the resources. So anyway, so let's end this epidemic. That's all I have to say.
Thank you so much, Lisa. We really appreciate that perspective and all the work that you're doing, and wish we can bring a lot more providers down that continuum. And just, it's great to know that there are providers out there getting this word out. And as you heard from Lisa, you know, it's important to bring it up in everyday conversation. You know, we need to, not only do we need to get it out to our own HIV community, but we have to get it out to the public at large. And so that is a goal and a challenge and something we all want to be thinking about and working towards. So with that, I'm going to, I want to make sure we have enough time for some of the questions as well as our panel. So I am going to switch over to our panel, and I will ask once again, just a really brief introduction of, I'll start with Davina and then Maria and then Katie, of, you know, who you are, and just a, you know, a snapshot of what your role with U=U has been, and then we'll talk about kind of some of the changes you've seen both in the community and for you personally. So Dee, you want to start?
Yeah, like I said before, my name is Davina Connor, and I joined U=U right after Bruce Richman started 2 years ago. And I started because I knew that being undetectable was something that needed to be shared with all communities. So I jumped on board. It is saving lives. It is giving people diagnosed with HIV hope. It is letting women know that didn't know, because some providers are not telling them that they can have babies, which we've known for many years. It's giving them hope to know that they can have children. I had a baby years ago, and I knew that I couldn't transmit HIV to my husband that I was married to for 15 years. So I keep telling everybody that U=U is my life, and it is actually my life. I talk about it daily. I don't think there's a day that passes that I don't talk about it. For work, I am a Lyft driver, and I have these little cards in my car. So I discuss U=U while I'm riding around with people in the car. I discuss my status, I talk about HIV, and I discuss U=U daily. And that is the only way that we're gonna be able to get the word out of U=U, is if we share it. I tell a lot of people, you don't have to be diagnosed with HIV to share U=U. This is something that all communities need to know.
Thank you. And we'll be hearing more from Davina soon. And Maria, I'll ask you to go next. Oh wait, we can't hear you. Let's see. Okay, 1 second. Okay, now it's good. Okay.
You guys hear me good now?
Yes.
I tried with the phone, but I guess you guys couldn't hear me. I hope that you guys hear me well. Again, I know that it was a little static and when I presented myself. My name is Maria Mejia. I'm very proud ambassador for the WELL Project, your CAB member and blogger. I'm also a part of the National and International Steering Committee for U=U and a human rights activist, also a 31-year survivor of HIV, which leads me to what I have always told. This set me free. It's very, very hard because I didn't have access to treatment. As we all know, back in those days, there was nothing. And I had to many, many years with the mental stress that I could transmit this human condition to my partner. And few years after, there was the Swiss statement. So we kind of already knew around women, you know, not social media or anything, but we kind of knew that it was very hard for a woman to pass it on to a man, but we didn't really until the Swiss statement came. But as a CDC ambassador that I'm a part of as well, as I told Bruce, I joined them as well 2 years ago, but at the beginning, I'm very reluctant, always have to research, and the same thing I did with PrEP. I had to observe, I had to look at the studies, and I basically wanted to be set free. And this happened mostly when the CDC came out with the statement, because I've been attacked a lot on social media because of it, like Bruce has as well, and Davina, and I'm sure Katie. They said we had blood in our hands, that we were making people go and have sex unprotected, that we were promoting promiscuity, like all these horrible stigmatizing things. And this is not about that. Like Lisa was talking about, we're not talking about other STIs or even pregnancy. We're talking about undetectable equals untransmittable. If you have an undetectable viral load, and I have been undetectable for 22 years, and I was very, very angry with my providers because almost all of them knew the truth and they were gatekeeping. A lot of the organizations and the executive directors knew the truth and they were keeping it within themselves. And a lot of these people were long-term survivors like myself. And when I found this out, that they already knew, and their excuse was that they didn't feel they were responsible enough, which was one of the attacks, I got very offended, and obviously I went to social media and I've made a video. The reason why they attack you equals you is because of access to treatment. Like, for example, Lisa also spoke about that in Venezuela and many places in the world. People here in the United States that fall in the cracks. And I tell them this also gives them an incentive to fight in their countries so they could get access to treatment, because if, like Mr. 45, because I cannot mention his name, deciding not to end HIV, like Lisa said, we're gonna go along with that. And he has to have access to treatment for all, because access to treatment is a human right. And for those that are undetectable, that feel ostracized, just like Bruce talked about in one of his slides, I was detectable for 10 years, obviously because I had no access to treatment. So people still, if they don't have the access to treatment, tell me, Maria, still want the accurate information. And everyone deserves to know the truth. Thank you.
Thank you, Maria. And Katie, just a little bit about yourself and your kind of role with U equals U and involvement in the campaign.
Hi, everyone. I'm Katie Willingham, blogger with the Well Project, ambassador, U equals U ambassador, and Alabama State lead for the Positive Women's. I'm hearing some echo. Is anybody else hearing that?
It's gone.
Okay. But yeah, I found out about U equals U in 2016, and I was completely floored by it. Came home, probably immediately became a U equals U advocate, because I started telling my family and everyone. Talked to my doctors about it, and at that time they weren't so willing to talk about it. They weren't willing to get behind it, and I didn't understand why. Like everyone else, I didn't understand why they knew this before, and I was just finding out because for 16 years I had been pretty much just waiting to die, and I wasn't living. I allowed living with HIV to stop me from doing so many things, like even playing with my children, and so U equals U had such an effect on me. I knew that this was a message that had to get out. So I started a Facebook group and to educate people about HIV issues and U equals U. And I've been doing that. I tell everyone I know.
Thank you. And as you saw, Katie and Dia also are involved in the Positive Series campaign, which you can access from Prevention Access Campaign's website, and then you're able to customize and download materials there as well. So I know we've got about 20 minutes left, and I know we have several questions. So, you know, as an organization that focuses on women, I would just like to ask you all, you know, both from, you know, either a personal perspective or from, you know, the community perspective at large, like how have you seen this message, you know, impact women, especially? Like, I mean, in what ways do you think that it, you know, may have a slightly different impact for women? I mean, I think it obviously decreases stigma amongst everyone, but like, have you seen anything noticeable that, you know, there's a reason to get this out to women, and what your perspective is on that? And feel free to jump in.
Well, I've seen the impact with women, especially with the just posting on social media. Social media, I mean, it's broad. It's so broad, and you can reach a lot of people on social media, even those that are not open with their status. So I'm sure Maria and Katie get the same thing. So I get a lot of messages from women that are diagnosed, and they tell you thank you for sharing U equals U that they didn't know. I always guide them to the website so they can get more information. So that in itself just makes me smile, because I always say if you can reach one person, you're doing your job. So yeah.
Hi, this is Lisa. If it's okay for me to jump in. I do have a number of frequently middle-aged women clients who, for a very long time, have not dated at all. And every time I talk to them, I ask them obviously about sexual partners, because all clinicians should be asking their clients, no matter who they are, about their sexual health, because it's part of who we are, but that's a whole nother issue. But they still, even when I talk about U equals U, it does give them hope. However, they often still are reluctant to tell any new partner, so they just prefer not to even try. And honestly, that breaks my heart. And so if anyone out there has advice for me as a clinician on how I can be more positive with them, I'd really appreciate that.
Yeah, I mean, Maria, I know that you had some experience. I mean, I think there's one thing with, you know, that we're hearing a lot too. I mean, we know that the prevalence of depression and isolation is very high in women, and, you know, and feel that they won't be able to do it again. But Maria, I know you were sharing some of that on some dating apps as well, and you had some experience of how people received the messaging, right?
Yes. Well, I got separated from a 10-year relationship, and I got into the dating apps. I didn't know anything about it, because back then it was so like MySpace and AOL. So as I got in these apps, I immediately went as who I am, an advocate. I talked about it. Actually, I got like 15,000 messages from just men in South Florida, and cisgender men, and some women. And immediately, some of them even said, "Are you here? Why are you here? Are you here like to promote yourself or the message?" And I'm like, I'm here for both reasons, you know, because I want to educate. And a lot of people disclosed to me that we're not on treatment because of the stigma. And that gave them an incentive to go to a doctor. I even referred them to my clinic, many of them. And they're on treatment now because, yes, they do not disclose sometimes because of fear, but they are making sure they're proactive with their health, and they're undetectable, just in case that happens, that they have unprotected sex. Something in the mind happens where they don't feel like they're going to kill someone. And for Lisa, the best way to tell your clients about, you know, how to change that mentality, either because they're a long-term survivor, and a lot of the times us, you know, we're stuck in our idea or in our trauma. but we have to let go of that. I suggest that you send them to us, the people that are living with HIV that have had successful relationships with magnetic, as a magnetic couple, one being positive and the other one negative, and give them the information, because sometimes they do respect the providers, the doctors, nurses, but they can relate to us more. And they sometimes they believe us even more because we have lived with this condition. We're living with this condition, and we are examples that, you know, we cannot transmit this condition. I had unprotected sex with my monogamous relationships throughout my whole relationships, and there was no HIV transmissions, and that's science and that's facts.
Thank you. I mean, have you, I'm sorry, was there echo there?
There still is, Krista.
Okay. Is this any better? Better,
Yeah.
okay. You know, one of the questions, I mean, around self-esteem and stigma, you know, I think is a big part of the U equals U messaging. And have you seen a difference in, you know, like changes of people's lives, you know, over the past couple of years? Have you seen people transform because of this messaging? And maybe give an example. No? All right. Well,
The question is for who?
Go ahead, Maria.
the panel.
Oh, go ahead, Davina.
No, I was just going to say that there's some people that have became advocates because of you, believe it or not. It's exciting. Again, just this whole aspect of U equals U, it gets me fired up. And just having the ones that didn't agree in the beginning come forward and apologize and say that they're sorry. And I always say to people that you can't let someone else tell you about what you're living with. We know what we're living, and we know that we've been undetectable for many years. So why are people fighting it? Stop fighting it. We have the CDC, Janssen, Lancet, the Whale Project, many organizations that have jumped on board U equals U. They have Walgreens now, ViiV. So it's about the science, you guys. Don't let it scare you. We're not promoting condomless sex at all. People diagnosed with HIV need to know that they cannot transmit HIV any longer. But again, like I said, people have become advocates because of U equals U. Just knowing that you're not infectious anymore, it just brings this kind of joy inside of you where you just want to start telling everybody. So that's how I see it, because of the many people that have became advocates because of it.
Great. Well, thank you. And Katie, what about you? Have you, you know, in your time being involved in advocacy around this, have you noticed transformation? I mean, you said yourself you were transformed by the information and this knowledge, but have you witnessed that transformation with others?
Well, when I was diagnosed, I was in I was married. So I've been in a serodiscordant relationship throughout the entire time I've lived with HIV. Even when after my marriage ended, and a lot of that had to do with a drifting apart between us, because there was a lot of lack of intimacy, and we really drifted apart through the years. I was just terrified of being intimate, and I found out about U equals U close to the end of the marriage, but it was too late by then. When I started dating again, I found it difficult to date because you know, the HIV revelation would shut down a lot of conversations, but educating people about U equals U would open a lot of those conversations back up. And I was actually able to date a wonderful person who was at the time terrified of contracting anything, and she would not date me until I had told her about U equals U. And I had seen a lot of that. I've seen a lot of people change their, overcome their fear of HIV by learning about U equals U.
Thank you. Well, so I think we have a few minutes left. We had several questions, and one of the first questions that came through was, let me pop it back up, was that, we know that U equals U applies to sexual transmission, and the question was around needle sharing and the implications of U equals U on that. And I think the short answer is that there is some research. I'm going to actually ask Bruce if you want to pop in on this, but there is some research that is, I think, underway, but really we don't have enough research to apply U equals U. So Bruce, I'll hand it over to you.
Yeah, it does not apply to sharing needles at this point. And we have heard about some research and we're trying to track it down, possibly see if, because it's such a direct route of transmission, but we think it most likely does apply. We just can't say it right now.
Thank you.
Also, just want to quickly say, people who share needles also have sex. We have to remember that. At one point, people were like, "This doesn't apply for people who are, for people who inject drugs," and we were like, "Yeah, it does. They are having sex too, so they need to know as well." Please make sure that you're telling everyone, including people who inject drugs. Thanks.
Thank you, Bruce. And a couple other questions were, one person wanted to comment on breastfeeding, and we'll see if we can make that happen. But just a lot of questions, as I said in the beginning, are arising around breastfeeding because of U equals U. I think, and we have some great resources on our website, so I won't go into too much detail here, but, the kind of the long and the short of it is that U equals U, like I said, the research that we have right now, which there's not a lot of, does not show that U equals U applies to breastfeeding. The risk, if someone is on undetectable viral load, it's a very low risk of transmission, but we can't say zero at this point in time. That being said, the guidelines outside of the United States, the WHO guidelines, the WHO guidelines, do recommend breastfeeding. A lot of places that may not have access to clean water or formula, and if someone's on an undetectable viral load, they do, for the health of the infant, recommend breastfeeding. Here in the United States, that's not the case. And the guidelines recommend formula feeding, and they do have some information around how to support a woman who chooses to breastfeed. However, that is not, it kind of still puts women in a position, if they do choose to breastfeed, there's a lot of kind of fear around criminalization. Child Protective Services, anyone in the medical field can, call Child Protective Services and basically say child endangerment if it's known that a woman is trying to breastfeed. It's sometimes also that choice if a woman chooses to, and it may have a lot of different reasons, including those that, people outside of the United experience. There may be people who don't have, you know, the resources for formula or access to like clean water. They may choose to, you know, for their own reasons, culturally, for bonding, for maternal health, for infant health, choose all sorts of reasons. And because of that fear, they may not end up going to their doctor regularly, and they might miss treatment. So there's a lot of issues that we need to think about in terms of policy changes to really support women's informed choices. And we also need to push for more research in this area, because I think with more research, we may find out more than what we have right now. So in our follow-up to this webinar, when we share the recording and put everything on our website, we'll also include links to some of those pieces as well, just for more information. Okay, and other question. Okay, I'm just looking at some of the questions. Okay, so once a person living with HIV has an undetectable viral load, is there no chance that one of those questions that came through, is there any chance that it will increase to detectable again? So we'll throw that out to our panelists or speakers, Bruce, Lisa.
I would like to say something.
Maria?
Like I mentioned, I've been undetectable for 22 years. If you're very concerned about becoming detectable, it's normally because you're not being adherent to your medication. That's why we have to stay on top of our labs. And at least I go every day to get my labs. And like I said, treatment works. I've been undetectable for 22 years. So hopefully that answers the question of the person.
Yeah, I was just gonna say no. Just stay on your meds, keep up with your doctor's appointments, and no.
Yeah, as long as you're taking your meds, this is Lisa, sorry. As long as you're taking your meds, you'll remain undetected. I tell my patients all the time that HIV is not going to be your problem. It's usually smoking. That will be the problem.
That is true.
Thank you. So, and then there was a question about education and advocacy for women in the military and vets about U equals U and HIV. And Bruce, I think you might be able to jump in on this with, I feel like, wait, you're muted.
What's the question?
Okay, there you go. Oh, sorry. You know, is there education and advocacy for women or people living with HIV in the military and for vets about U equals U? Do you know if there's been
a campaign developed for, you know, well, the Veterans Administration was one of the first federal public health departments to update their webpage right after the CDC. They have an undetectables, untransmittable webpage for the Veterans Administration, which is the largest single healthcare provider of AIDS care in the United States. And I know that Reggie Dunbar, who works with PAWS military vets, is really a passionate advocate about this. But I don't know of any specific campaigns in the U.S. that are directed toward people that are in the military. I don't know about anything particular about it. The Veterans Administration is really doing excellent work and is on it, and you know, and getting the message out through their channels. So maybe I guess that would be the campaign that I know about.
Yeah. Okay. I think we are just about at time. Are there any other questions that I've missed? I'm trying to see, or any final comments from our panel about? I mean, I've seen a couple comments about the chat, and there has been a lot of rich conversation in the chat. We are going to try and save that and include the transcript with our post-meeting materials. But you know, please feel free to get in touch with us about how we can help you disseminate this information. I saw, you know, information about the stickers, which, you know, are great, and we'll consider that. We're working on a pamphlet that's going to include U equals U to disseminate to organizations, and specifically, you know, frequently asked questions for women. So there's questions on long-term survivors and U equals U, and also involving children and also mainstream media. So those are questions that I did. So I know we're about to wrap up, but if anyone wants to stay on and just we can quickly go through those questions. Does any of you want to address, you know, long-term survivors and getting this information out to, you know, there's been some reluctance amongst long-term survivors around U equals U and kind of your hearing of that and how you've been able to you know, get that messaging out and work with people that don't necessarily want to accept these messages after living with the virus for 30 years and having a hard time, you know, accepting the content. You know, who wants to answer?
Tez Anderson's, you know, organization, you know, let's kick ass for long-term survivors is doing a lot of work in this and is very committed to U equals U. And I think there is a lot of trauma and folks who have experienced the worst part of the epidemic, and so it's more about an emotional thing, getting through the trauma and the PTSD of the plague. And then in terms of mainstream, and Tez is really an expert on that, Tez Anderson. And in terms of the mainstream media, no, most of the mainstream, we haven't gotten a lot of media attention yet in the US like they have in the UK, mainly because our national organizations aren't hiring publicists or using their communications agencies to get this in the mainstream media. We're looking at the UK as an example of how organizations are really reaching out and getting, like Prince Harry has said, can't pass it on. You know, I mean, it's like U equals U. And I'm actually reaching out to my friends in the entertainment industry actually today to see about how we can get this integrated into more of popular culture in entertainment in the US. So, and hopefully we'll see our national organizations step up and use their communications team to get this on CNN and in People Magazine and all that sort of stuff. I know Maria was in People Magazine, but they cut out all the U equals U stuff because it was from a big agency that didn't believe in U equals U. So they silenced Maria. A lot of the stuff going on, which I won't talk about right now, but thank you so much for having us and making this a priority. The Well Project is unbelievable. And you know, we are so grateful to you.
And I want to add something, I'm doing like a piggyback from what Bruce is saying. I am interviewed a lot, and one of the things that I'm very, like I tell them, if you want me to be in this campaign or you want to interview me, you must include this message. And sometimes they have tricked me, and Bruce knows it. And these are very huge or global organizations. But when I'm being interviewed in mainstream media, which is a lot, radio, TV, magazines, all throughout the years, at least these years that we've known about undetectable equals untransmittable in English or in Spanish, I do mention it, and they can't do nothing about that. They cannot cut something that is live. So, you know, and this is not where I am in the world. So, you know, it is what it is. I got to speak the truth.
I just want to say one thing to everybody. Share U equals U with your providers. I tell people, if your provider doesn't want to listen, find another provider. It's your care. You have to be responsible for your care. And if your doctor doesn't want to listen to what you have to say about your care, find a better doctor. There's an advocate that is on the steering committee of U equals U, and he says, the same doctor that told us that we were infectious is the same doctor that is telling you can no longer transmit HIV. So, and that was from Brian Jones. So, I mean, share it. Talk to your doctors about it. My doctor, every time I go in there, I take a stack and give them to her, and she sits them out for everybody. So you have to share it. And if they don't understand, again, lead them to the website so they can do some reading on it. But thank you, everybody, for
thank you all. And I just want to, to just kind of reiterate what everyone is saying, share it and reshare it. You know, just because you say it once doesn't mean that people are going to listen. I think that's, you know, one of the points of having this webinar we did one 2 years ago, but maybe we should be doing one, you know, every year or more than that, you know. But I mean, whatever places or opportunities you can, one time is probably not enough. So it does bear a lot of repetition and trying to get people to listen. So thank you, everyone. Thanks to our awesome speakers. I know Lisa had to leave, but thank you all. And such great participation. And we look forward to following up with you all.
Thank you.
Thank you.
Bye.
Bye.
Bye.